What is a biopsy specimen in cancer diagnosis? Imagine trying to solve a mystery by looking at a tiny piece of a puzzle. That's exactly what a biopsy specimen is in cancer diagnosis. It's a small sample of tissue or cells taken from a suspicious area in the body, like a lump or abnormal tissue. This tiny piece is collected through a medical procedure called a biopsy. Once taken, it is sent to a laboratory for detailed examination. The main goal is to find out if the cells in that sample are cancerous or not. Biopsy specimens are very important because imaging tests like CT scans, magnetic resonance imaging scans, or X-rays can show us where something abnormal is, but they cannot tell us if it is cancer. Only by looking at the tissue under a microscope can doctors see if the cells are malignant, meaning cancerous, or benign, meaning non-cancerous. This helps in making an accurate diagnosis. There are different ways to collect a biopsy specimen depending on where the suspicious tissue is located. A needle biopsy uses a thin needle to remove a small core of tissue or fluid, often guided by imaging to be precise. An excisional biopsy involves surgically removing the entire lump or abnormal area in one piece. Sometimes, only part of the lump is taken in an incisional biopsy. For areas inside the body that are hard to reach, doctors might use an endoscopic biopsy, where a thin, flexible tube with a camera and tools is inserted through natural openings or small cuts. Each type of biopsy provides enough tissue for pathologists, who are doctors trained to analyze tissues, to examine the structure of the cells, look for genetic changes, and test for specific proteins. These details can influence treatment options and help doctors decide the best way to care for the patient. For families and caregivers, understanding that a biopsy specimen is a small piece of tissue taken to confirm or rule out cancer can help support their loved ones during this process. Waiting for results can be stressful, but it's a vital step to ensure the correct diagnosis. This small tissue sample is the key piece of information that guides doctors in understanding the nature of the illness and planning effective treatment.